Blumenthal, and to our witnesses, thank you for your support of veterans. Ms. Hundrup, I wanted to start with you. As you highlighted in your testimony, veterans often experience hardships in the transition period where they leave the military and re-enter civilian life. As you know, the GAO recommended that the DoD and VA's Joint Executive Committee, which oversees the coordination of healthcare and benefits between the military and the VA, assess the effectiveness of DoD's and VA's efforts to facilitate access to mental health services for these transitioning service members. So can you discuss why it's important to make these kinds of assessments and how they can help lead to potentially improving the health care that our veterans are receiving during this critical time?
Yes, thank you. So in our work, we identified a number of helpful touch points across the transition continuum, which is 1 year before separation to 1 year after. However, there was oftentimes some confusion about which program they need to or how it works, sometimes an awareness, lack of awareness. Some of the programs we found were late. So for example, there were 2 programs, Solid Start and In Transition, both noble programs with good intent, but they were identifying the veterans 2 to 3 months after separation, which is already very late in the process. And so, and there was also potential duplication, getting similar phone calls, which was resulting in confusion on the part of the veteran, maybe being overwhelmed, not knowing. So not only was it late in the process, but looking across, there are a lot of different programs. I think each individually have, again, noble goals and provide critical services. But looking across, there was, maybe some in some places that were a little too late, some that might be.
Right. But can you, as we look at assessing this, especially for mental health care, what is the value of this assessment in terms of mental health access?
So the value of this assessment will be to look across and identify the timing, whether there are gaps, whether certain things could be done earlier, whether, for instance, is the separation health assessment is supposed to have a mental health assessment. That's not happening now. Okay. So I think they could identify what is happening, where there are gaps, maybe there's overlap or duplication, and really look systematically across, which I think could result in some savings on the part of DoD or VA or both, and they can take those and shift those so that's really coming at the right time in a clear manner for the veteran that is better understandable. So I think it's going to result in a more cohesive, holistic approach.
And I think that's, critically important. As somebody who advocated it and worked on the Solid Start program, the idea was day 1 of the transition, there would be these things in place, right? And that means that the organizations have to start planning before the veteran separates. Dr. Kroviak, let me kind of follow up in a way on what Senator King was just talking about, because one of the issues you've raised is medication management for veterans who are receiving community care. And you've discussed it's really important that veterans who receive community care have their opioid prescriptions coordinated and monitored by the VA. The coordination and oversight obviously can be life-saving for veterans struggling with pain and mental health conditions. In 2023, the Inspector General's office looked into VA oversight of community care opioid prescriptions and found, and this is a quote, gaps in care coordination, documentation, and the use of risk mitigation strategies for system patients receiving community care. In your testimony, you stated that 2 of the 7 recommendations from that 2023 report still haven't been implemented. So what problems remain in terms of ensuring that community care providers and the VA are working together to ensure that veterans, especially those who are being prescribed opioids, are getting the safest, best care that they can, and what can we do in Congress to help?
Yeah, so I think those 2 recommendations you're referencing are specific to that information sharing, and we have been working with IVC, which is the Integrated Veterans Care program office that runs community care. It is a struggle to ensure that communication and oversight of that effective sharing of information, and it will require likely changes to the contract, modifications to the contract that VA has with the TPAs currently. They are up to renew that contract in the coming year. They are taking our considerations and concerns very seriously, and we meet with them quarterly to discuss how we can move forward with ensuring these things happen.
Well, let us know if we can be helpful in that way in urging forward. And I'm just about out of time, so I'll follow up in writing, but I am continue to be really concerned about the issue of veterans, especially with mental health issues, being given the right kind of follow-up instructions about their medications when they're discharged. So I'll follow up with a question in writing for you on that. Thanks, Mr. Chair.